Good morning, and welcome to this morning's podcast session. And today we have with us Jason Tomlinson and Jason White from My Health Onsite. So thank you for being with us this morning. And today we are here to hear from you a little bit about Hilo Open Access. So before we get started, can you speak a little bit about your unique setup and how you are a non-conventional practice?
Absolutely, and good morning, and thank you. So yes, we are in the employer healthcare space, a little bit different. We are a closed type of network where we're not open to the general patients and the public. All of our client groups in that employer healthcare space happen to be in the public sector arena. So we partner with large cities, counties, school districts, sheriff's offices, fire districts throughout the state of Florida and provide primary care family practice services in addition to occupational health services. So it's a unique model. We've been doing this since 2007 and absolutely love and enjoy what we do.
Okay. And how has Hilo Open Access helped your unique patient population?
So our unique patient population in that our groups are typically public safety officers, school teachers, city and county employees. They don't have a lot of time during their workday to pick up the phone and try to schedule an appointment. So by utilizing the online access, whether it's the web or whether it's the Hilo app, they've found it much more streamlined and a much quicker way to be able to book an appointment with their provider or to get their lab scheduled.
Very convenient, very convenient.
That's a very good point you made because I think most patients at this day and age, to call up a practice, to be put on hold for several minutes to merely get an appointment, why don't we just provide them with the convenience of booking an appointment and pick a day and time that's convenient for them? Because I think when we were speaking earlier, you mentioned the example of making a reservation for a restaurant. I mean, when we have the convenience, why don't we provide the same convenience to our patients, right? I absolutely agree, and I think it definitely takes the patient care to the next level. Now, so how have you been able to customize Hilo Open Access to fit your niche need?
This is one of the most amazing aspects of it that we really love about it. Since JT mentioned we do have unique client groups, we have 24 facilities, but we have numerous client groups, and only certain client groups can utilize certain facilities. So is what we're able to do with the Hilo Open Access is to be able to be an employer-based to where if we have a sheriff's department, they can only go to certain offices. So with the Hilo Open Access, we're able to partition that off to be able to have them only schedule at certain centers that they're allowed to, and it makes it phenomenal.
That's great. That's wonderful. And one thing I know many users always wonder is when it comes to implementation, how long does a typical implementation take, and how much have you invested in testing and making sure the setup is done right before they say turn on the switch for the patient? So would you like to speak a little bit to that?
I'll take that question. We actually had an amazing relationship and a fantastic team on the eCW side to partner with us and to test this as we were moving our practice from an old antiquated system, EMR system, over to eClinicalWorks. We immediately moved into the patient portal, and then after that, about a 3 to 6 month testing period before we jumped into the Hilo and into the open access. The team was absolutely amazing to work with. They gave us all the different wireframes to test out in our test environment. And our patients were accustomed to already online scheduling, so moving into the new model, and it was a seamless transition because they were able to go right from the old system into the patient portal system, and shortly thereafter, 3 to 6 months later, the app was available through open access.
That's very good. I know I'm going to ask you an impromptu question that I did not put on the list of questions. Well, one thing also I've personally heard from some of my clients is, what has been your marketing outreach to engage your patients and educate them prior to what you call a go live? So just kind of, if you can speak a little bit about that, how you were able to get that going.
Absolutely. So we have a marketing team internally that we utilized. eCW had some forms and different websites that we could access to kind of use in our environment, and we tailored that to our client groups, and we started sending out communications about 180 days prior to the transitions. So our patients were well informed. They knew who to call if they had any questions, and they had materials emailed to them, and they were available for them at their work site so they could see what was about to come. So they were very informed as to what the process was going to look like. And it made just the transition a lot better for everyone involved.
That's fantastic. To me, I think half the battle is to engage your patients prior to an initiative going live. So you did that part very well. So, and besides Hilo Open Access, can you speak a little bit about, how you utilize Patient Portal for, patient communication and maybe other features if you're using those as well?
Yeah, the patient portal, it's basically an extension of Hilo with the web-based. It works and functions just as easy and simple as Hilo. One of the good features that we enjoy in it too is we're able to send messages directly to the provider. Again, you mentioned convenience. If you're at work or you're in between shifts or something, instead of having to call and go through the process of waiting and getting contacted with a person, they're able to go in, they're able to ask a question to the provider, it gets sent to them. It's kind of just as convenient as scheduling an appointment to where they don't have to call up and be put on hold and all that.
So also along the same line, maybe I know our viewers are probably curious as to hear from you. I bet no implementation goes without a hitch, right? We can say that. What are some of the common challenges that you faced, during this testing and the implementation that you worked through? Maybe you can learn, maybe they can learn from you and you can share some advice.
So when we transitioned into the Hilo product, we noticed that the scheduling for our patients was more provider-based. And so if a provider didn't offer a specific visit type, for instance, maybe one of our providers didn't do a joint injection or a well woman visit, and the patient was scheduling that appointment with the provider, and then they went to go pick the reason for visit or the visit type, they would have to start all over again, and they would have to loop back around and pick another provider. So we worked with the eCW team, and it was wonderful. They helped us completely reprogram the system so that when a patient goes to schedule an appointment, the very first thing that they're asked or prompted is, what type of visit are you looking for?
What do you want?
And then from there, it would cascade down as to the provider and the facility that then they can confirm that. So it made it a lot better for our patients. It made it better for our providers and our staff. They didn't have to reschedule the patient with a different provider because that provider didn't offer that specific visit type.
Well, you know what? I know what the feature that you're talking about, and on behalf of some of the clients that I presented, thank you for helping us enhance that. I think it's a very useful feature, when you think about patients and how they go about making an appointment. So thank you. Well, with that, we would like to wrap up this podcast session. Thank you, Jason, for being here and giving us your time and sharing with us your thoughts on your implementation and success of Hilo Open Access. Please tune into our podcast in a few minutes, and we'll talk about another one. Thank you.